Hello and welcome to 72 Dragons Health. Today we had the pleasure of speaking with Joe Begay. Joe Begay, an enrolled member of the Navajo Nation originally from Shiprock, New Mexico, is currently pursuing his PhD in epidemiology from the University of North Carolina at Chapel Hill. His primary research interests include cancer epidemiology, intervention epidemiology, and longitudinal data analysis. He is enthusiastic about using epidemiologic methodologies to develop scientifically solid, culturally relevant evidence throughout the cancer care continuum. He serves as an outgoing communications officer at the Men's Health Caucus in the APHA. He's also the outgoing policy and resolution officer for the American Indian, Alaska Native, and Native Hawaiian Caucus, among many other commitments. In addition to student engagements at the University of North Carolina. Welcome, Joe Begay, to this interview. We are honored to have you with us today.
Thanks for having me.
Joe, as a native public health expert, please tell us about the projects you worked on to help build public health infrastructure for the American Indian and Alaska Native communities.
Building public health infrastructure, for me, I think it's integral in to have training in research as well as receipt of public health education. And so I'm happy to share some of the projects or experiences I've had throughout my undergraduate and graduate training that has kind of culminated to my pursuit of a PhD. And I do attribute a lot of my passion now for research to my experiences as an undergrad. So I'll start there. So as an undergrad, this was based in Colorado. I had interned with Harvard Medical School and Brigham and Women's Hospital through the summer medical and dental education program. At the time I was a medical, I planned on going to medical school. So I was pre-med, wanted to learn more about medicine, medical training, and that particular program was hosted by the University of Louisville in Kentucky, here in the U.S. and that experience shed light on the health professions, and not just medicine but also dental, and that was really helpful to kind of just learn more about, again, the health profession. But then the following summer I interned with the Four Directions Summer Research Program up in Boston, and that is where I worked with a pulmonologist investigating lymphangioliomyomatosis, and which is a interstitial lung disease, looking at the molecular mechanism of the proliferation of that particular cell type. And I found a huge interest in doing research, being able to combine biochemistry with research and applying it to improve patient health, individual health, but also community health. And as a result of that particular program, I ended up working with the University of Utah at the Native American Research Internship, both as an intern as well as a program coordinator, supporting the interns, learning more about doing medical or biomedical research, but also integrating public health aspects into the various different projects. Some students were working in emergency medicine, others were working in pulmonary medicine like myself, others were working in pediatrics. There was a variety of different projects occurring at this particular experience. And so it was really, I think, important to think about how does public health fit into all of these different areas, because we recognize that public health is very much an interdisciplinary field, and that we have to work with clinicians as researchers as well as community leaders and the communities themselves, right, to improve community health. So I received that like foundational undergraduate summer research experience throughout, my undergrad training, which kind of culminated or like led me to pursue a master's of public health in hospital and molecular epidemiology at the University of Michigan, working in this like instructor role with other students, with students who are Native themselves or allies working with Native communities, has really fueled my interest in building public health capacity, building public health infrastructure, and providing high quality training to these folks so that they can go out and do it themselves. Um, and really, again, kind of just building that public health capacity, which has really led me to pursue my PhD that I am today, where again, I continue to support that Hopkins certificate program. But I'm also now working, reconnecting with the Northwest Portland Area Indian Health Board, and served as a co-instructor recently for their end of summer research training program, and provided a training and introduction to epidemiology. And so it's just really nice to be able to kind of bring all of these different experiences together, even from my undergrad all the way up to my graduate experience, at the master's level and doctoral level, all of which have really just shed light on the importance of A, education, B, training, and then C is like applying all of that training to improve Native health in a culturally congruent manner.
What were some of the highlights or insights from the work you did at Johns Hopkins Center for Indigenous Health? What would be the main highlights of that work?
Yeah. So I worked on two projects that aimed at increasing cancer education, cancer access, and outcomes among two tribal communities in the Southwest. And this was a huge advancement for the Center for Indigenous Health because these were the first two projects that were a part of the Center for Indigenous Health's like research portfolio, right? The center had never done anything like this prior. So it was really an honor to support the center in this way in conducting their first cancer-related research projects. And so that being said, one of the projects I helped prepare and launch, I was a program manager. I helped prepare and launch a randomized control trial that investigated the effectiveness of a community-driven, culturally relevant intervention. And so one arm, participants received access or were randomized to receive cancer education materials that consisted of a brochure and a video. And then the other arm, participants received those cancer education materials. So again, that brochure and video, in addition to a female Indigenous like health professional. I guess some would call them like a patient navigator, right? And this is in the context of breast cancer screening, breast cancer mammography, right? We wanted to increase mammography screening rates among this tribal community, and so we had that particular intervention, and that work is still ongoing. By the time that I had left back in 2023, they had recruited, their first few participants, and that is like a 5-year program. So again, that work continues to this day. The other project that I had worked on while at the Center for Indigenous Health was I helped conduct some formative work to develop a novel tablet-based intervention that delivered cancer education in a culturally competent manner. And when I say culturally competent, I meant we incorporated testimonies from not just physicians, but also tribal cancer survivors and traditional healers on the importance of A, women's health, but also B, cancer and specifically breast cancer and the importance of being screened for cancer. And so again, those projects are still ongoing, and it's just been my experience with the Hopkins Center for Indigenous Health has been nothing but positive. And I'm actually hoping to return as a postdoctoral fellow someday.
A very exciting project. Now, what motivated you to be part of the APHA community, and in what ways do you think your research and work support the APHA theme for this year, rebuilding trust in public health and science?
I think one of the initial motivations for joining APHA was to be around like-minded health professionals who had similar lived experiences. Speaking to the indigenous public health community that's available within APHA. And so, on that note, it's just much easier to connect and brainstorm culturally relevant health solutions for our people. So that was always a highlight, always one of the motivations. And so that being said, though, that's how I encountered the American Indian Alaska Native Hawaiian Caucus. And so I wanted to join the caucus and support Indian country through policy and resolutions. And when I had initially joined, one of the main priorities was missing and murdered Indigenous women and persons, MMIWP. And so as a result of that being one of the caucus priorities, I organized this 4-part webinar series to understand MMIWP, from multiple perspectives, from 4 different perspectives, actually. One was the tribal perspective, another being at the state and county level, third at national level, and then the fourth at the federal level, right? And so through this webinar series, we brought partners from each of those 4 perspectives to learn more about MMIWP and what are the resources that are available, with the intention of bringing all of these resources together to improve and address this epidemic of injustice that is MMIWP. So our call to action following that webinar series was to essentially create and improve and enhance surveillance systems that are ongoing. Some states have a surveillance system and others don't. And so again, kind of from this health equity lens, how do we build public health infrastructure for those states that do not have surveillance systems, and then for those that are in existence, how do we make them better and improve and prevent missing and murdered Indigenous women and persons.
Thank you for sharing. Now, after completing your PhD, is there any particular area you're looking forward to focusing your research and work?
Yeah, so my main interest is, I'm not sure if you've noticed, but it's in education and training. And so following my PhD, I hope to pursue a career in academia where I will be able to train the next generation of epidemiologists, and not only work with aspiring health professionals, but also conduct research in cancer epidemiology. My knowledge and expertise on the cancer care continuum, and so I'm really hoping to better understand. I think I'm still definitely more interested in cancer prevention and cancer control. And when I say that, I mean I'm actually interested in screening amenable cancer. So not just breast cancer, but also cervical cancer, colorectal cancer, stomach cancer, etc. And in particular, I'm very interested in infectious agent-associated cancers. So, for example, HPV and cervical cancer, or even H. pylori and stomach cancer. Because through the prevention and control of infectious disease, we can also prevent and control cancer in those sites. And so, I like to think that I have a good idea, but I think my interests continue to evolve. But nonetheless, I have such a great network of mentors and advisors who have all contributed to helping me, figure out where do I see myself giving back exactly. And I think when it comes to Indian country, again, I think giving back through training and education, both in an academic setting, but also in these summer research experiences that I had previously mentioned, guest lecturing, or maybe even creating my own summer research program for Native students. I think the world is at my oyster. The world is my oyster, and I think it's just a matter of what do I want to do, right? And I think I've really come to realize that, especially through my parents, anything you put your mind to, you can really get it done. So very thankful to be here.
A lot of great opportunities. Thank you, Joe Begay, for speaking with us today. It was a pleasure to discuss the insights about your research and its impact on public health. Wishing you great success with your PhD and all your future projects. Thank you.
Thank you so much. I appreciate it. Yeah,